this a couple of times, and this brings a lot of relief. And that is an onion poultice to put on the throat. So you finely slice the onion, and you get a cloth. And then you place the slices of onion on the cloth, like so. And then you fold it over so it's going to make a long rectangular shape. And then you put this on the throat, like so. And then you can wrap a woolly scarf around that, or you can put a little bit of plastic on it. I don't really like putting plastic on the skin, but it will cover it. And that onion, of course, is discarded as soon as it's used, but that can take the edge off a sore throat. There's something else you can do with the onion, and this is very, very effective for someone that has a bad cough. And with this, you finely slice, or finely chop, I should say, the onion into small pieces. I have done this many times on my grandchildren, because sometimes when my grandchildren come to stay with me, they've got coughs. So you chop up an onion into small pieces, and you can get a lot of these out of one sheet, and you shall see you'll use them. And say you've got one onion, you chop the whole onion, and half the onion goes into one cloth, and then the foot is put straight onto that. And then you pull the cloth over the foot, and then put it in a plastic bag and tie it around the ankle and put a sock on. Now the bottom of the foot, the skin of the foot, goes straight onto the onion. So I saw this with one of my grandchildren. He was only 3 at the time. I was visiting my daughter Emma, and the little one had a cough, and we'd given him a hot bath and a warm lemon drink and put him to bed. And he coughed, and he coughed, and he coughed. And it was over half an hour, and he just coughed and coughed, and we just thought, he'll go to sleep soon. But he just kept coughing. So we got him up, chopped up the onion, and put it on both feet, put the plastic bag around it, put the sock on, and put him back to bed. Not one more cough. Not one. It's quite incredible. You almost have to see it to believe how effective it is. And a friend of mine, she was camping, and she knew of this remedy. And in Australia, we've got a lot of coast, and she was camping by the sea, and there were a few tents, and the lady in the tent next door coughed and coughed and coughed most of the night. And the next day, in the afternoon, my friend approached her and said, I see you have a cough. She said, I'm so sorry, I can't stop coughing. I think I'm keeping everyone awake. My friend said, I have a remedy that may help. She said, anything. So when you're camping, I think you've always got onion. And when you're camping, you've always got some plastic bags. And she didn't have any cloths, but what she did was she just put the onion in the plastic bag. 2 plastic bags, chopped up onion in both, put the foot in, wound it round the ankle, and then put the sock on. She told the lady what to do. It's a bit hard to walk if you've got onion on the bottom of your feet. And no cough. No cough for the whole night. So it's a very good remedy for people that have especially coughing in the night. Obviously, because the onion is a drawer, you would discard the onion, of course, in the morning. The biggest pores in the whole of your body are on the soles of your feet. So the soles of your feet, basically they have been used traditionally in many cultures for centuries, sometimes to massage, sometimes to apply essential oils there, because the body takes it up very quickly from the soles of the feet. And I presume that is why it works so effectively. because the soles of the feet take up the onion and it's absorbed into the blood. And remember Psalm 104 verse 14, that God gave herbs for the service of man. The body sees the onion and knows exactly what to do with it and where it should go. Now I'm going to show you how to make a onion cough syrup. And to make this cough syrup, you will layer chopped onion and honey in a jar. So we have a little jar here, and you put, depending on the measurement you use, about 1/2 inch or 1 centimetre of onion in the jar, and then you'll pour in about a teaspoon of honey. Making a bit of a mess here. Then you put a little bit more in, about another 1/2 inch or centimetre, and then another teaspoon of honey. In Australia, we buy a bucket of honey at the time, and we buy raw honey. And in the cool winter, when it's very cold, the honey goes very hard. You might have seen it, almost like candied honey. And I have made this with just a lump of that hard candied honey, and it still works very well. In fact, I think it's important as much as possible to get the unheated, unprocessed honey, get the raw honey. A lot of honeys that you buy in the supermarket have glucose syrup with it. They're not the pure honey, and they've been heated, and heating the honey certainly changes it. So ideally you use the raw honey. Now if you want to make this and you haven't got honey, you can use maple syrup. You can use palm sugar, and the palm sugar, also sometimes called the coconut sugar, is the crystallized nectar from the palm flower. And as you can see why onion is so effective with respiratory. I'm starting to cry a little bit here. In fact, that's a really good sign if you start to cry when you cut up your onion and your eyes start to water. It means this onion has not been irradiated. If you chop up an onion and you don't cry, it indicates that it's been irradiated. So now, usually the last one I might put a couple of teaspoons on, and you sit this for 24 hours, and after 24 hours it'll have formed its syrup, and you can strain the onion out. So this is my own natural plate scraper called Finger. So by the end of our evening, we will see the syrup form. It won't be fully formed, it takes 24 hours to form, but you'll see it start to be formed. So as I tip this, all that I've got is sticky, gooey honey and onion. But by the end of the night, when I tip that, you'll see a syrup which is almost as watery as water. So we'll let that sit there. So how do you use the onion syrup? To use the onion syrup, you take a teaspoon, maybe an adult would have a teaspoon 3 times a day for all respiratory problems. For a child, it might be half a teaspoon. 3 times a day. So for a baby it might be a drop, but not very much. So there are some of the things that you can do with the onion. A relative of the onion is garlic. And garlic is what we call God's antibiotic. And you can use it as an antibiotic if you want to use it as an antibiotic. So we'll have, that's quite a large clove. You would need to have at least 3 of those a day. Not everyone can handle raw garlic. If you find it a bit hard on the stomach, you can finely grate it into a bowl of soup, and that will just take the edge off it. Something that I like to do, I call this my antibiotic sandwich: a slice of sourdough toast, olive oil, and then garlic, and you get this fine grate. Put that over the bread, avocado and tomato on top. Very nice. So the bread and the olive oil underneath calm the raw garlic, and the avocado and the tomato on top, they calm it down too. It's a very nice way to have it. But I'm going to write you up the recipe for flu bomb. And the flu bomb is a mix that you can take for any respiratory problems. So for a head cold, chest cold, COVID, bronchitis, pneumonia, sinus, any of those problems that affect the respiratory, you can use the flu bomb. So with the flu bomb, the number 1 ingredient is garlic. I'm not going to put a measurement there because it depends on how much you can take. Some people might be able to take 2 of these. I could probably handle 1. Or some people might be able to handle a little one. I used to give this to my 2-year-olds, and they would drink it even though it's very strong because it relieves all symptoms of a cold. So I'll leave it up to you, but it's usually finely grated or crushed. The next ingredient is ginger. And for ginger, it's usually about 1/4 teaspoon, and that's finely grated. The next ingredient is cayenne pepper. And I haven't got an amount on there because it depends on how much you can take. Some people can take 1/2 teaspoon, some people can handle a light sprinkle, so I'll leave that one up to you. We'll be talking about cayenne pepper in more detail this evening. Eucalyptus oil. And there definitely is a measurement for this, and that is 1 drop. A lady said to me, "Barbara, I bought the eucalyptus oil, but it says on the bottle, must not take, not for consumption." I said, "We're not suggesting a teaspoon. That'd just about knock you out, but there is common sense, isn't there?" In fact, I met an 80-year-old lady, this is when I was only in my 20s, and she said when she was a little girl, one child had a cold, all the other children had to line up, and the mother would give them a teaspoon with a few crystals of sugar and a drop of eucalyptus oil on it. In Australia, you can buy eucalyptus oil lozenges, so obviously it has been taken internally. See what happened, and this happened about 45 years ago in Tasmania. You've heard of Tasmania, it's that little island at the bottom of Australia. A little boy drank out of a bottle of eucalyptus oil and went into a coma. So they banned eucalyptus oil. Now, the little boy did recover, and there was such a protest against banning eucalyptus oil that they legalized it again. But every bottle of eucalyptus oil you buy, it's got poison on it, and it's got "do not take." So we're not suggesting you drink 1/2 cup. This is 1 drop. It amazes me that we do have young people sometimes daring one another to drink a bottle of scotch and they die. Their liver can't cope with the amount of poison. So have they banned alcohol? Incredible, isn't it? So moving on with our flu bomb, the next is lemon. If lemons are $1 a lemon, you might use half a lemon. If the lemons are falling off the lemon tree, you might use a whole lemon, so I'll leave it up to you, your access to lemon. And the last ingredient is honey, 1 teaspoon. Believe me, you could put 4 teaspoons in that and it will not improve the flavour. And that is mixed with half a cup of hot water. That's the flu bomb. There's your antibiotic drink. And if someone has a cold and they take a flu bomb 3 times a day, usually within a couple of days, their cold has resolved. I've had people say to me, it takes away all the symptoms. The sore throat eases, the runny nose reduces. When someone gets a cold, did you know that it's a house clean? That's all it is, it's a house clean. And all the mucus that gets blown out, it's the waste coming out. In the 1940s, the Common Cold Research Unit was set up in Salisbury, England, to find the cause and the cure of the common cold. They would put someone in a hot bath and then put them out in the cold wind. They didn't get a cold. They even got someone that had a cold and scraped the mucus off the back of their throat and put it on the back of the throat of the person they're testing, put them in a hot bath, put them out in the cold wind, didn't get a cold. Have you noticed when a cold goes round, some will get it and some won't? You know, the ones that get it are the ones that need a house clean. And we all need a house clean sometimes. So after several years of all this type of research, the Common Cold Research Unit was closed down because of the total failure to find the cause and the cure of the common cold. Because it is a house clean. And if you give the body the right conditions, the house clean should only last about 24 hours. What are the right conditions? Flu bomb 3 times a day, sleep with chopped onion on the bottom of your feet, have the onion syrup, eat very lightly, drink a lot of water, have some hot peppermint and ginger teas, have a sleep in the day, go to bed early. Make sure you go on a walk in the morning, breathing in through the nose. You'll need a pocket full of tissues to keep the nose clear so you can breathe through your nose. Such simple things that you can do to bring about healing. But you can't give a flu bomb to a baby. And there's another thing that you can do to get garlic into a baby when they've got a cold, and that is to finely slice garlic. Now I need to stress this point because I have had a few people tell me, one mother told me recently that they grated the garlic, they put it in the cloth, and now there's a big blister on the bottom of the baby's feet. I had another mother tell me she crushed the garlic, put it in a cloth, and that blistered the baby's feet. But if you finely slice it and put it on the cloth, it will not blister the baby's feet. Now, of course, if you blister baby's feet, you can't put any more garlic on there for a while, and the baby will recover. And so what I've done here, I've put the garlic on one side, put the cloth over, and we'll pretend my hand is the baby's foot. So can you see what's happening here is I have a cloth between the fine slices of garlic and the feet, and that will not blister. But you will find within about 2 minutes of putting this on the bottom of the baby's feet, you can smell it on the baby's breath. It takes 1 minute for 1 drop of blood to go around your whole body. And remember, the biggest pores in the whole of the body are on the soles of the feet, so it takes it up. And remember, the body knows what to do with that garlic. And it can ease the tightness of a chest cold. The garlic on the feet can even relieve congestion in the nostrils with the cold. So it's just another little hint that will work with the body to bring about healing in these conditions. I used to put it on my son James. He was 3. Had a chest cold, and I put it on the bottom of his feet, put his socks and his shoes on, send him off to play. Every step that he takes, what's happening? Little bit more garlic, little bit more garlic. Whereas when you crush it or grate it, all the juice is available too quickly, and then it can burn the bottom of the feet. Not severely, it'll cause a blister and it will heal, but ideally we don't want to blister the soles of our baby's feet. But you can use just the sliced garlic. At the end of the day, when I put it on James' feet and I'd give him his bath and I'd take the garlic poultice off, the garlic was like bits of dried out leather. There was no juice at all left in that garlic. So that's how you can give a little baby garlic. So what we're going to look at now is ginger. And ginger can be used internally and it can be used externally. And ginger is well known internally as easing nausea. If you buy seasickness or car sickness tablets in the health food shop, it'll be just concentrated ginger. You can also grate the ginger, pour boiling water on it. It's probably my favourite tea. And I know in Asia, if you have a massage, when you come out, they'll always give you a cup of ginger tea. Ginger warms from the inside. If someone's very, very chilled and you give them a hot ginger tea, it warms them up nicely from the inside. And you can see it's part of our flu bomb. I was at a conference and I saw a lady with a tiny little grater and some ginger. And she was making a cup of ginger tea, and I said, ginger tea. She smiled. She said, I'm an entertainer, I'm a singer. I was in Greece and I lost my voice. And a little Greek lady made me a hot ginger tea. She said I sang that night. So she said I travel everywhere with my little grater and buy the ginger. There's no need to peel it. So how I make the poultice, and this is the mess-free way to make it. I have a plate or I have a chopping board and I put the plastic down. Now notice I've used cling wrap, but I've folded it over a few times so it's just a little bit more usable. And I put the cloth on top of that. Now notice the size of the square and the size of the cloth. It's much bigger because I'm going to make a parcel. And then I just grate the ginger straight onto the cloth. And I'm going to use the fine grater. So why am I making a ginger poultice? The easiest way to remember what the ginger poultice is for is ginger is for joint inflammation. In a minute we're going to have a look at the poultice that you would use for tissue inflammation. But the ginger is specifically used for the joint inflammation. So because it's so good at pulling inflammation out, it can be used for gout, it can be used for arthritis, it can be used for a painful lower back, and this is not my favourite grater because all the ginger seems to get stuck. So what I might do is I might do a few on the big one. So you can use some finely grate and some bigger grate, and of course that gets it out a lot easier. Now if I was at home making this ginger poultice, I'd get as much ginger out as I could of this grater, and then I would pour boiling water onto that into a pot, and I'd make myself a ginger tea. And so I'm pressing this around. You can see the juice that's already coming out in the poultice. And I'm making a little parcel. So I say east and west, north and south. So I've made a little parcel, as you can see, and then I turn that around. So the area that's going to touch the skin is where there's just one layer between the grated ginger and the cloth. Now the beauty of making a poultice like this is you've got quite a few layers behind, so that if it gets a little wet, it'll soak it up. And notice too how much plastic I have got around the edge. Why do we use plastic? We use plastic to insulate it, to stop it chilling, and also to protect the clothing. Now let's say that let's say I've got a sore thumb joint. So this is a good size for that. You can see the colour, how the cloth is quite wet with the ginger juice. And I will put that over my sore joint, like so, and I check that that plastic covers it, and then I bandage that on with a bandage. Now when we use the ginger poultice on any guests that might have a sore knee or sore ankle or sore elbow or sore joint in any way, we will apply it about 6 o'clock at night. Because if there's a lot of inflammation in the joint, then the skin is going to get very hot. And some people will say, my skin's burning. Well, it actually isn't burning, it just feels like it is. So I say to the person, can you handle it? Because if it's too hot, we'll just take it off. Even if it's on for half an hour, it has done something. But some people say, oh no, it feels very, very good. So I had a recent experience with this. I was home for 3 weeks, and in that 3 weeks I made a point of seeing all my children and all my grandchildren. And I went to Tasmania because I've got a couple of daughters down there and quite a few grandchildren. And my daughter Julia, who's 39, she was in bed. Now Julia, you cannot hold her down. She's busy. She said, I've hurt my back, I can't move, I can't get out of bed. She's got a little 2-year-old, little 6-year-old, and I praise God for His perfect timing. Have you noticed how perfect? Kilo bucket up onto the tractor, and yes, she didn't listen, and the back got very hurt, and so that back laid her in bed for 5 days. Oh, I'd come in the morning, she's crying. Why aren't I better? Give it time. And sometimes you just have to give it time, isn't that true? So I said to her, let's try a ginger poultice. And I put the ginger poultice on her lower back just before she went to bed. And I went in about half an hour later. I said, is it warm? She said, it's very hot. It appears that the ginger pulls the inflammation out of the joint to the skin. Now, if someone's got a sore back and they put a hot water bottle on it, it does bring a bit of relief, because whenever you're in pain, the muscles, and you don't choose for this to happen, it's an involuntary response, the muscles tighten, almost in sympathy with the pain. And when you put a hot water bottle on the area, the cramping muscles relax. But you put a hot water bottle on any area that's inflamed, it's going to get more inflamed. So it's sort of a catch-22 situation. So we put the ginger poultice on her back. And in the morning she said, "Mum, that was amazing." She said, "It stayed hot all night." If you put a hot water bottle on your back, by 3 in the morning, what's happening? The hot water bottle's getting cold. And she said that the pain levels went right down. So what the ginger poultice does, it pulls the inflammation out of the joint and it heats the area, and that's the inflammation. But that heat relaxes the muscles. So can you see it helps in every way. It reduces the inflammation and relaxes the muscle. So the next night she said, "Please, Mum, can I have another one of those ginger poultices?" So the good news is Julia's out of bed now, and she made some decisions while she was lying in bed. She's going to drink more water. She's not going to push her back beyond endurance anymore, and she's going to start strengthening her core muscles, which will help to hold her back. It's amazing how our body teaches us things, isn't it? So that's the ginger poultice. Remember what it's for is joint inflammation. So we had a man who was about 35 to our program. He's a barrister. Barrister was the highest tier of law. The barrister are the ones that go to court and have the wigs and the black robes on. And he was a very quiet man, and he said to me in the initial consultation, he said, "I'm just here to stop drinking for a week. Don't tell me to stop drinking. I'm not going to stop drinking alcohol. I'm just having a week's break." And I said, "Oh, isn't that sometimes all you can say?" Oh. He was very quiet. And then on Wednesday night we did the poultice demonstration. And he said to me, "I've got a little toe that sits up like this." He said, "I can't wear shoes." He said, "I'm dressed up for court." But he said, "I have to wear a slipper on that foot." He said, "It's very embarrassing." And he said, "This toe has caused me pain for 18 months. I said, "Well, let's try a ginger poultice." And with a ginger poultice for the toe, you make a tiny little cloth. But remember, you make it about 4 times bigger than you want the poultice, as you saw with this. We grated up probably half a teaspoon of ginger, made it into a little poultice, put it on his toe, put a little bit of plastic round it, and then just taped it on and asked God to bless that poultice. Now this man was a very quiet man, and the next morning we heard this yelling, and we looked out and he's coming down from his room, and he said, "It's gone." The toe was flat. 18 months he'd suffered with this swollen toe. It was from gout. Now the next day, the lecture on the acid-alkaline balance was given, where we showed that arthritis, gout thrive in an acid environment. And guess what a very acid-forming drink is? Alcohol. And he was eating a lot of meat, was another acid-forming food. In the final consultation, when we're sitting there, he said, "I'm going to stop drinking." Praise be to God. All because of a little tiny ginger poultice. Do you remember what he said to me in our first consultation? "Don't tell me to stop drinking, because I'm not going to." I don't tell anyone what to do. I give them information. And they choose. They choose. Because God's government is a government that's based on freedom. And freedom is based on free choice. Now, what you can do, you can make this poultice ahead of time, wrap it over, and even put it in a little bag. Now, I would not keep that poultice probably more than maybe 12 hours, because it is fresh ginger. But you might be visiting someone with a sore back, and you might advise having this, for a couple of hours before they go to bed, and you make it up for them and put them in a little cloth. And often just our underwear, our pants will hold it in place. So that's the ginger poultice. It's a very effective poultice. Now I'm going to make something that is the best for tissue inflammation. Remember, the ginger's for joint inflammation. But I want to tell you one more story that illustrates. A lady saw my poultice lecture on YouTube. She had a sore knee. She did the ginger poultice. It got very, very hot, but her knee started to move. And so after a few hours, she took it off and did another one. And then before she went to bed, she took it off, had a hot shower, made a fresh one and put it on overnight. She was so excited. The pain had gone. She had movement in her knee. You can see why, because the inflammation was taken out. But when she woke up in the morning and she took the ginger poultice off her knee, the tissue was swollen and there were little blisters. And she emailed me and said, "What have I done?" I laughed. I said, "You've just overdone it." You just pulled too much inflammation out, and to the point that it irritated the skin. So with the ginger poultice, I advise people just do it for a period of day, maybe for a few hours in the afternoon, because as we go through this, you'll see some other poultices for tissue inflammation, and that's what the humble potato does. So again, we've got our plastic and our cloth. We put the cloth down and we grate the potato. Potatoes for the tissue inflammation. So I mentioned this morning how I had a crash on my bicycle a few years ago. I wasn't watching where I was going, and I was going over our wooden bridge and my wheel got caught and I went over. And my face smashed against the little side of the bridge and came up like a duck egg, and now I've got a dent. But what hurt the most, that hurt, but I think you go into shock, was my finger. I said to my son, I said, "What is it with my finger?" He said, "You've got a big fat splinter that just went in under the nail." Oh, was that sore. He said, "Grit your teeth, Mum, I'll pull it out." Well, that was just too painful. I said, leave it. I'll put a potato poultice on it. So you can see the idea of how much potato you put on and the cloth. And again, we're going to do north, south, east and west to make the package. And you turn it over and there's your potato poultice with just a bit of plastic around the edge. And you can see it's starting to get wet there, and it's the juice. So I put a grated potato poultice on my finger and slept with my finger up in the air. And I slept, praise be to God. And the next morning there was no swelling at all. And I think I put the potato poultice on it 3 nights in a row. There was no swelling and there was no pain. And after 3 nights I noticed that it was starting to pull towards the surface. And all I did was squeeze it a little bit, and I saw it pop out more, got tweezers and pulled it out. There was no swelling, no pain. The potato had just kept all the tissue swelling down, and it had also softened it and it drew it out. Just the simple grated potato. I just need to ask time. Will I go a little longer? What's our time like? I'll keep going. We'll have a break after the potato. So we had a man at our retreat, and he was a bit of a hippie. He was living on the edge of the property. This is quite a few years ago now, in the early days. And he was sickling the grass with a sickle. The sickle, in bare feet. And the sickle went in behind his ankle bone. Now, I didn't see him for a few days, and one of the guys said, "Have you seen Chris? His foot's up like a red balloon and he's got a red line going up his leg." Ooh. Now, tetanus can only get a hold on the body if there's an element of horse organism in the soil, because horses carry tetanus, and you've got a wound that heals on the outside but it hasn't healed on the inside. That's a perfect storm for tetanus. So I said, bring him up. Now, unfortunately, this man, who was a bit of a bushy, living in the bush on the edge of the property, he smoked marijuana, so he was lying in bed smoking marijuana, waiting for nature to heal. Nature will heal if you give it the right conditions. And unfortunately, that marijuana was easing the pain, but that pain was important because it was actually telling him, do something. So the pain was taking away the voice. You see, pain has a purpose. It's telling you something. He couldn't walk. So I made the biggest grated potato poultice I've ever made to go round his whole foot. Because I looked and the wound had sealed on the outside and it hadn't healed on the inside. Now what I did first, I'm going to show you in detail tomorrow night. I did alternating hot and cold foot baths, which is 3 minutes hot, 30 seconds ice cold. I did that 3 times. And what that does is that brings a massive amount of blood to the area, and when you increase the blood, you increase the healing. I'll show you in detail tomorrow night. And that can bring a lot of relief. And then I put a big grated potato poultice on his foot, bandaged it, and asked God to bless it. And I said, come back in 2 hours. Now, after the hot and colds and the grated potato, his pain had reduced by almost 50%. I would like to suggest he was in 10 out of 10 pain. It's just that the marijuana was blocking it. So that's quite dramatic drop in pain. And why the pain level had dropped? Because the hot and colds and the potato had reduced the inflammation. He came back after 2 hours and the red line was going down. And the foot was down, its swelling was down by half. When I took the poultice off, the wound was oozing. That's what you want. You want that wound to ooze until it heals from the inside out. We did another hot and colds. We did another grated potato. And by then I think it was evening. And I said, come back in the morning. When he came back in the morning, he was walking. He was not even limping. And that red line had gone down below his knee, and the foot was back to normal size. And so the body was, what was the body saying? Yes. Now, if after 2 hours the red line was no better and his pain levels were worse, we just take him straight to hospital. But I have to tell you, I've never had to do that, because we have found that the natural remedies have the effect. So what we look at always is history. How did this happen? Symptoms, and the symptoms are the voice of the body speaking to you. Remember, if you will diligently hearken to the voice of the Lord thy God in your body, listen to what the body says, and then you watch response. And when you're watching response, you are again listening to the voice of God in the body. And that man's response said, yes. The response when I had that potato poultice was, yes. The body said yes. And how it says yes is you've got some relief. Quite an incredible story, because that man, I don't know how much longer he would have lived if he hadn't done anything, because that red line was really blood poisoning. And when that blood poisoning gets to the heart, the person doesn't last long. And that's why I think that verse in Exodus 15:24, where the Bible says, if you will diligently hearken to the voice of the Lord thy God and do that which is right in his sight, in the body's sight, give ear to his commandments and keep all these statutes, I'll put none of these diseases upon thee that I put upon the Egyptians, for I am the Lord that healeth thee. And God heals us through the processes he put in the body to heal, and the natural remedies that work with those healing processes. So what I've done so far, I would like to say just about every home has these things in their home, don't they? Which is the onion, the potato, and the ginger. So one last story to finish the potato, and we'll have a break. My son, when he was 10, he got a very large splinter in his foot. I didn't know it was in his foot because he was limping. And I looked at his foot and there was a bit of a hole there, but I thought the splinter, whatever he pushed on, must have come out. So what I did was I put a grated potato poultice on his foot every night, and I did hot and colds before I put it on, hot and colds in the morning, but still all day he's limping. And I said to a friend of mine, I don't know what's the matter with William's foot. It's 2 weeks and he's still limping. Well, my friend pushed the bottom of his foot and William screamed. And my friend said, there's a lump of wood in the bottom of his foot. He said, he'll need surgery to get that out. William looked a bit worried. I said, it's all right, William, we'll do grated potato surgery. Because I knew that the potato was a drawer. So I want to draw for you exactly where this was. And this gives you an idea of, and of course, eventually this splinter came out. So this is 2 weeks that, that he's been limping. And we've been doing the hot and colds, and I wasn't too worried because there were no red lines. He wasn't complaining of any pain, but he was still limping. So it appears, there it is, it appears that so I'm not a great drawer, so just bear with me. And this is a foot. There's the toe, there's the ball of the foot. It's a foot. Try and make that look a little bit better. There's his toe. And the hole was just here. And so what I did then, I did non-stop grated potato. I did grated potato from morning till the middle of the day. Changed the grated potato. At the end of the day, hot and colds, another grated potato overnight, so we did non-stop grated potato. His foot looked like a dried prune, but we wanted to get this out. And after 2.5 days, there was a black ring, and that black ring would have been the size of a lentil. I saw some lentils here. Where are the big, these brown, probably the size of one of those. And I looked at it and I flicked the skin around it aside and then put a needle into the side of this black thing and started to pull it, and it just started to come out. So I stopped, called the family because we've been watching Will limp for weeks. I said to William, you do it. And he pulled it out. It was 1 inch long and the thickness of 2 matchsticks. So it wasn't in like this, it wasn't like this, it seemed to be that it was on an angle like this. And when it first happened, now that's a 10-year-old foot, so that would have been how big it was in a 10-year-old foot. When it first happened and I saw the hole, I actually put tweezers a little bit into the hole to see if there was anything there, and I couldn't feel anything. So that was in quite a way, but the hot and colds and the grated potato pulled it out. He's still got a scar on the bottom of his foot where that splinter was pulled out, and that's the power of the simple grated potato. So we'll have a break now. We'll have a 10-minute break, and when we come back we're going to be looking at a few more things.
Did you enjoy that session?
We don't usually put it in water because some of the healing properties can go into the water, so it's either steam
Okay, 3.
Welcome back everyone as we continue this very exciting presentation on natural remedies, and I'd like to show you that our onion syrup is coming along. Can you see that runny liquid? That's our onion syrup. So at a stretch, if you had someone with a bad cough and you wanted to give them a teaspoon of this, you can see that in about an hour you'll have some syrup. But ideally you let that sit for 24 hours and then you strain the onion out, and then that cough syrup can be kept in the fridge indefinitely. And it's actually very, very nice. So we might bring it back tomorrow and you can have a taste. So just to finish off with the potato is so gentle areas where it's sensitive. You would never put a ginger poultice on the eye, but you certainly can use a potato poultice. So sometimes when men are welding, they get red eyes. The potato poultice, even for half an hour, can reduce that inflammation. Conjunctivitis, I know in America they call it pink eye. The tear duct gets infected, put the potato poultice on, so it's very good for that. So tissue swelling, potato poultice, very good for sprained ankles, even broken ankles, wherever you've got tissue swelling. What we're going to look at now is castor oil. And castor oil penetrates, we'll stop there. So where will I start from? I'll just start again, yeah? We're going to look at castor oil now. Castor oil penetrates deeper than any other oil. I do not suggest that you drink castor oil. It can be quite irritating to the gastrointestinal tract, but it can be used topically. And no other oil penetrates like castor oil, and wherever castor oil penetrates, it breaks up lumps, bumps, adhesions. It can break up a bone spur. It can break up a tumour. We looked at it this morning when we were looking at different cancer treatments, if you remember. So now I'm going to show you how to make the castor oil compress. So the thicker you make your compress, the better. So I've got here 2, 4, 6, 8, I've got about 16 layers of cloth there. If you use toweling, you could use maybe a couple of layers. And then I've got the plastic behind it. So I'm going to pour an amount of castor oil on it, and then I'm going to let it sit because it's so thick. The castor oil is very, very thick, and it takes a while to soak into the compress. So you can't just make it and use it. So I can't tip that up or it's going to fall everywhere, but I don't know whether you can see that, but it's sitting like a bubble on top. And I'm going to let that just sit because soon it will soak through and I can show it to you. So where would you use that? So the lady that had the swollen knee, remember she used the ginger poultice too much and the tissue got swollen, she could do a grated potato on that for a couple of hours that would bring the tissue swelling down, and she could apply a castor oil compress over her knee overnight. What some people do is they'll do ginger for maybe 2 hours in the afternoon, have a shower, and then they put the castor oil compress on overnight. And the castor oil is also very good at breaking up scar tissue. So for someone that had surgery maybe 20 years ago, I know one guy, he had appendicitis, you know, when he was about 10, and now he's early 20s, and he was getting terrible pain. It was from the scar tissue. And if you wear the castor oil compress over the area, little by little it'll break up that scar tissue. Won't happen overnight, but little by little it certainly does penetrate and break it up. If it can break up if it can break up a bone spur, it certainly can break up scar tissue. Also, I've known ladies to conquer their fibroids, their polycystic ovarian syndrome, cysts on the ovaries, by using the castor oil compress. I saw a lady recently and she said, I've been using the castor oil and the fibroid's not getting any smaller. And I said, how often do you do it? She said, once a week. I said, no, you could do it 5 hours a day, every single day. So little by little, like the dripping tap on a stone, it certainly can break up those fibroids. So that's the castor oil. Castor oil can also be put on the eye. So it can be put in the eye for dry eyes, it can be put in the eyes for glaucoma, it can be put in the eyes for cataract. I spoke to one farmer out west in Australia. We call him a bushie, lives out in the bush. He said if ever he gets anything in his eye, puts castor oil in it. And he said that effectively pulls it out of the eye. So we talked about, in one of our later demonstrations in the evening, is talking about a first aid kit. I think you'll agree with me, the castor oil's got to go in that first aid kit. I'm now going to talk about cayenne pepper. Now this is a very good cayenne pepper. See how bright it is? When cayenne pepper's brown, it's old, it's not as potent. And cayenne pepper is a remarkable herb. The book Back to Eden by Jethro Kloss, he devotes half a page to every herb except for cayenne pepper. 10 pages he devotes to cayenne pepper. Some people think that cayenne pepper is not good because it's a stimulant. It's not a nervous system stimulant, it's a blood stimulant. And the blood is the life of the flesh. So tomorrow when we look at hydrotherapy, I'll be going into detail on why the blood is the life of the flesh. But basically the blood brings healing and takes away waste. So any area of the body that's not working well, you increase blood supply there, you increase healing there. And that's what the cayenne pepper does. When someone has lost feeling in their extremities, and this is a common side effect with chemotherapy, it's called peripheral neuropathy. They don't have feeling in their feet. And you can't put feet with no feeling into a bucket of hot water. You can damage the tissues. You must never do that. Like you never put cold feet into a bucket of hot water. You could put cold feet into a bucket of lukewarm water, and then as the feet warm up you could add a little bit more hot water. But what you can do to people with cold feet, what you can do for people with peripheral neuropathy, is you can make a cayenne pepper compress. So to make this cayenne pepper compress, and I've made this about the size of a foot, the size of my foot anyway. Some of the feet of these young guys here, this would not be big enough. And you put kitchen paper over it, or paper toweling, a couple of layers, and then we're going to dot that with olive oil. You only want to put a little bit on. If you put too much on, it's going to leak out, and there's nothing worse than it leaking out onto the bed. So the best way to do this is I just dot it with my finger. I'll dot it and then I'll show you what I've done. So the reason we're putting the olive oil on is so that when we put the cayenne pepper on, it'll stick to it. Because if you don't put oil on it, the cayenne pepper of course will just run to the side. So this is the best way to do it, so that you don't get too much olive oil. I know one of our staff did it to a guest who had no feeling, and they put so much olive oil on that the olive oil leaked out, and the lady's socks got oil on it, the sheets got oil. It was a mess. So you can see what I've done here. I've just dotted it. You see that? Dotted it with the olive oil. And now I'll sprinkle the cayenne pepper on. And what I usually do is about half a teaspoon per foot. And of course you do it to both feet. And if you have a little, have the cayenne pepper in a little shake bottle, you can just shake it on, but I'm just putting it on with my fingers. And the person puts their feet straight onto this. Again, you put one for each foot. Now, if I didn't have the oil on that, I couldn't hold it up like that, could I? So basically, it's just, the oil is just to keep that cayenne pepper on the cloth. And the foot goes straight onto that. And then you can put a sock on it. And if you feel that might leak a little, you can always put a plastic bag over the sock. And then the person sleeps with that on all night. And I have had people with peripheral neuropathy say to me, when I go to sleep at night, I can't feel my feet, but it's like there's two rocks hanging on the end of my foot, and even though they say they can't feel their feet, it's painful, it's very uncomfortable. So we put the cayenne pepper compress on the bottom of the feet, and the next day the man said, I've got pins and needles in my foot. Now what's pins and needles? That's the first sign of life coming back into the feet, isn't it? If I put that on my feet tonight, by about 4 in the morning, I might feel like my feet are on fire because I don't have cold feet. And I don't have cold feet because I never let my feet get cold. So when people have cold feet, and they've had cold feet for a long time, it's given a name called Raynaud's disease. But it really is just cold feet and hands. So what you can do, you can train your feet back into being warm. When you get out of bed in the morning, your feet are warm. So you don't put your feet on the cold floor. You put your feet in slippers. But you take steps so that you keep your feet warm. And if you do that, eventually it'll get the message and the feet will remain warm. So someone with Raynaud's disease, they would also benefit from the cayenne pepper compress overnight. If it is just for cold feet, you'd probably do the cayenne pepper poultice maybe 3 nights a week, and sometimes that's enough. For someone with peripheral neuropathy, they might do it every second night. But remember, you're looking at response. If the person's feet get too hot, you'd probably stop. When I was in America last year, I got a call from our retreat, and they said, we've got a man who's got burning feet. He has his feet out of the blankets at night because the feet feel like they're on fire, they're burning. And I suggested a cayenne pepper compress. Now you might think, why would you do that for burning feet? You know, it's the same problem, the circulation's not good. And I got the message back, it worked. He might only need to do it once. But you watch the person's response. Your body and their response will tell you how often to do it. I visited a lady who had peripheral neuropathy. She was an elderly lady and was from her chemotherapy. So I made her up 6 of these. That would be enough for 3 nights. And I just folded them over like this and put them in a bag. And then she could just open them and put them on her feet. Because cayenne pepper doesn't deteriorate, well, not like grated ginger would, you could make this up and, you know, they could sit like that for a few weeks. Once you've used it, you discard it. So you can use that compress anywhere in the body that's lost feeling. So some people have had a serious accident and a part of their arm or hand might be numb. You could do the cane compress on it. You can do a cane pepper compress on an underactive thyroid gland. So if the thyroid gland is overactive, you can do ice. That will slow it down. And when you apply ice, we'll look at that in more detail when we look at water therapy tomorrow night, it's 7 seconds on, 7 seconds off, 7 seconds on, 7 seconds off, until the area numbs. But for an underactive thyroid gland that needs waking up, you can use the cane pepper compress. And you would probably use a compress, I'll give you an idea of the size for the thyroid. So you use probably about that size to put on the thyroid. And I have a story to illustrate how it works. I was mentioning this when I gave a demonstration, and then that evening one of the guests said to one of the staff, I just heard about the cane pepper on the underactive thyroid. Can I try it tonight? So the staff did it. And the next morning the lady said to me, I've got good news and bad news. The good news is it worked. The bad news is I didn't sleep all night. So don't do it in the morning. I mean, do it in the morning. Don't do it before you're going to go to bed, because your thyroid gland controls metabolism. So your metabolic rate could raise, which you want it to slow down at night. So if you do it, you would do it in the morning. You might do it for a few hours in the morning, the cane pepper compress. Cane pepper internally is a remarkable herb. If you've got a sore throat, you can take cane pepper. Notice, yes, it's in the flu bomb, which I've already rubbed out. You can gargle with it for a sore throat. It might really tingle at first, but then when the tingling settles down, the sore throat has been eased. For low hydrochloric acid, to help digestion, you can take the cane pepper. You might take 1/3 of a teaspoon in a little bit of water just before the meal. You can use cane pepper for the heart. How would you use it for the heart? Cane pepper does 3 things. Cane pepper thins the blood. Best blood thinner. No need for rat poison, I mean warfarin. The cane pepper is far more powerful. Cane pepper thins the blood. Cane pepper opens the capillaries. It's a vasodilator that opens the capillaries. Cane pepper strengthens the arterial walls, so it's an excellent herb for the heart if someone's had a heart attack or a stroke. And if they find it hard to take the cane pepper, they can take capsules. Take a capsule 3 times a day. The last one we're going to look at is charcoal. Charcoal absorbs and neutralizes poisons. So the word for that is adsorb. Adsorb means something that can absorb and neutralize. And the charcoal has a huge surface area when you look at it under a microscope. So it's able to absorb many times its own weight in poisons. NASA used charcoal to filter air in outer space. NASA used charcoal to filter water in outer space. Hospitals use charcoal to filter blood before dialysis, and hospitals also use charcoal in emergency for overdoses. I was talking to one girl, she said, I overdosed, and they gave me a choice. I could have my stomach pumped or I could take charcoal. And many people, when they travel through Asia, they'll travel with charcoal tablets in case they get something called barley belly, which is diarrhea. They take the charcoal. So it can be used internally for diarrhea, for vomiting, for any cases of poisoning, and it can be used externally for bee stings, spider bites, snake bites, wasp bites. We've got some pretty nasty ants in Australia that give some nasty bites, and when you apply the charcoal poultice, it gives almost instantaneous relief. Now, when you mix charcoal with water, it's like mixing dirt with water. It doesn't mix very well. And so there are a few things you can use, like a gelling or a binding agent when you make the poultice. You can use slippery elm, and that's what I'm going to use because that's what I've got. And it's in a capsule form, so I'm going to empty the capsule out. When you mix slippery elm with water, it goes like a soft gel. But slippery elm in itself is quite a remarkable herb, and slippery elm, because when you put water with it, it goes like a soft gel. It's excellent for irritation in the gastrointestinal tract. So now I'm doing half charcoal and half slippery elm. You always carefully cover your charcoal back because you never want to drop this stuff. Makes a huge mess. So I've got half slippery elm and half charcoal there. So I'm adding a little bit of water, and I'm just going to add enough water so it goes like a soft gel. Something else that you can use is psyllium husks. It's a lot cheaper than slippery elm. I mean, at a stretch you could easily even just put a bit of flour with it as a binding agent. I'm waiting for this to bind, so I'll put a bit more in there. I'm just going to taste it. It doesn't. I don't think it's slippery elm. It's very bitter. Slippery elm's not bitter. So maybe we got the wrong capsule here, and it's not it's not going like thick gel. So just pretend that this was slippery elm. I think that's golden seal. It's very bitter. And you can put that in a poultice. I'm not going to put it in a poultice because it hasn't gelled. You can put that in a poultice, but I mean, we could even still do this. Before I move on, let's have a look at the castor oil. Can you see how that's soaked through very nicely? And then that's just put onto the area and wrapped overnight. So back to the charcoal. Oh, I think that definitely is golden seal. So we're just going to put this on a cloth, and even though it hasn't bound very nicely, that's still fine because that charcoal water going through will absorb and neutralise the poison from a bee sting, the poison from a wasp bite. But that's also a very soothing poultice to put on the eye. You can also mix up a charcoal slurry, which is putting water with charcoal, and the charcoal sinks to the bottom. Now you've got black water, and you can wash the eyes with that black water. So remember, charcoal adsorbs and neutralises poisons. So as we will see when we look at our first aid kit, that's a very good additive for the first aid kit. And our onion syrup is going very nicely there. And I think we've got a few minutes if there's any questions. We just had a question that came online. With the ginger poultice, can you use ginger powder? You could use ginger powder and it would have an effect, but it's not quite as effective as the fresh. You had a question, yeah?
How long do you keep the onion syrup outside the fridge?
how long could you keep it outside the fridge? With the onions taken out, it can be kept for quite a while, and because honey does not go off, I would endeavour to say you could keep it almost indefinitely.
So you remove the onion and just...
Yes. After 24 hours, you strain the onion out. Yes?
Can you use the cabbage for the tissue inflammation?
Can you use cabbage for tissue inflammation? You definitely can. And in maternity units, they're using the cabbage for women when the milk comes first in and their breasts are swollen and painful. And there's many a woman that has testified to the power of the cabbage. Cabbage very similar to the potato. So when you use the cabbage, you dip it in boiling water to just limp it, or a meat tenderizer can just soften the leaf, and then you wrap it around the area. That is true, yeah?
What poultice can you use for the reddening of the eyes and inflammation?
What poultice can you use for the reddening of the eyes? Your potato poultice. Potato poultice, or one lady recently at one of the retreats in Alabama had very sore eyes. She had a cold and her eyes got sore. She used potato poultice, and that's usually enough, but it was still sore, and so we alternated it with charcoal, and that helped a lot. Well, our time is up, and I just want to thank you for your attention, and we're keen to finish so that you can go home and get to bed early and have a bright mind for tomorrow's presentations.